Hi, Joe. Hi, Sarah.
Hello.
Good afternoon. Hi, Jennifer. Hi, Ginger. Hi, Derek.
Hello.
Hi, Janet. Hi, Paula. Hi, Lucy.
Hello.
It's 3 o'clock. We're going to go ahead and get started. Hello, welcome everyone. My name is Alana Hine. Welcome to the 2420 work group, and would like to welcome you all to our meeting when we're going to be looking at and sorting through options that you all were kind enough to share and use your brain power to form, and hopefully everybody's had a chance to look at those by now. I want to remind you that this is a public meeting and the ground rules are that we're recording. There is a frequently asked questions link that Cindy will put in the chat that links to all of the work that we've done so far. The people who can speak and post in the chat in this meeting are the House Bill 2420 work group appointed members. And today what we're going to do is to review the agenda, to look at the options that you all proposed, and to start sorting through those, reminding everybody that the equitable fees and equitable access for the vital record system is what we are charged with paying attention to. Any questions about the agenda? Then we'll do a quick round of introductions and get started. Okay, let's start with the end of the alphabet. That means we'll ask for introductions from Jennifer, Paula, and Sarah. Jennifer?
Hello, good afternoon, everyone. I'm Jennifer Woodward. I'm the State Registrar for the Center for Health Statistics.
Paula, then Sarah, then Derek.
Hello, I'm Paola Sols. I work for Clackamas County as an office supervisor.
Sarah, then Derek.
Hi, Sarah Reynolds with Macy and Son Funeral Home in McMinnville.
Thank you. Derek, then Joy, then Janet.
Derek Patterson, liaison to the counties for the State Vital Records Office.
Joy, then Janet, then Hayal.
Joy Goodwin. I am the County Registrar for Douglas County.
Janet, then Hayal. Are you here, Janet? Maybe, I don't know. I can come back to you, Janet. We can't hear you. Hayal, then Jennifer, then Lucy.
Can you hear me now?
Oh, yes, I can hear you now.
Oh, my Wi-Fi is so bad. Now everybody's like in slow motion. I'm sorry. Can you hear me?
Yes, I can hear you.
Yes.
Do you want to introduce
All
yourself?
right. Now I can't hear you guys. This is nuts.
Okay.
I'm going to go and come back in.
Okay. Hayal, then Ginger, then Lucy.
Hi, everybody. My name is Hayal Barón Garcia. I'm a Deputy Registrar at Malheur County Health Department.
Thanks. Ginger, then Lucy.
Oh, sorry. Didn't mean
Go
to
ahead.
talk over you.
Go ahead.
This is Ginger Sorolla from Jackson County Vital Records, lead deputy registrar.
Thank you.
I'm Lucy Gibson. Sorry, Lana. I'm Lucy Gibson with Oregon Department of Human Services Child Welfare for District 4, and I'm a federal revenue specialist.
Thanks, Lucy. And then Stacy.
Good afternoon, Stacy Clark, Chief of Staff to Representative Owens, who introduced the bill for this work group.
Thank you, Stacy. Did I miss anybody?
I am a repeat offender. My name is Shauna Peterson, not Hallie Peterson.
Thanks.
I'm an attorney in private practice who does estate planning and estate administration in Malheur County, Oregon.
Thanks, Shauna. And we can see if Janet, are you back?
I can hear you. Can you hear me?
Yes.
Huzzah! I just have to make an entrance, you know. What can I say? I'm Janet Fredrickson. I'm the supervisor here for Vital Records, Environmental Health, and Office for Josephine County.
Thank you. Virginia? Virginia, you put it in the chat. Virginia Lopez, Harney County Health Department Deputy Register, audio issues. Okay, thank you. That's been going around. Thank you everyone for introducing yourself. What we want to do today is to take a look at the options that were presented and that we mailed out to you all. We compiled them, took everybody's options that were suggested, put them into one document, and we're going to go through them, and I'm going to be asking you to help talk about the things that you liked and also if you have any questions. There will be homework again because it's a lot to get through in an hour's meeting. So we will be asking you also to comment in writing between now and the next meeting. Let's see, let's start sharing the document. Cindy, are you able to share it? I might have lost Cindy. Cindy, can you hear me? Nope, might have lost that. James, do you have the document? Are you able to share it? Oh, here it is.
I'll post a link.
Actually, can you hear me?
I couldn't hear you, but I can now. And
it doesn't show that I'm sharing the tab?
It shows now that you're sharing it.
Oh, okay.
And James is also putting a link to the document in the chat.
Okay.
Thank you. Technology is our friend. Okay. So
I'm gonna go back on mute. Great.
Cindy, can you scroll down to, so these are all of the options that everybody sent us collated into some packages of options. What I want to do, go through them today, is read through them, hear what you like. This is for the work group members. You can either unmute and say what you liked about each one, or you can copy and paste into the chat the things that you liked. And as I noted before, we'll get through as much of the document as we can with the goal toward answering questions. And then we will also be asking you for feedback on this document between now and our next meeting. Cindy, if you'd scroll to the comprehensive, Jennifer?
Yeah, so thank you, Alana. I need to get clarification on the organization because there's 46 pages here. So is it organized in the sense of, you have a 1, 2, and 3, are those options? Or could you kind of explain how this is organized? Because it seems like are they organized in different options, or yeah, if you could just enlighten me, because I have looked at it, but I see a lot of repeat, but I just didn't know if if we're focusing on one, big 2, big 3, or within each one. So that would be helpful. Thanks.
Sure. Thank you. So the way that the homework was organized and the way that this feedback to you all is organized is based on the needs that you all identified for the vital records system. And the options are in response to those identified needs. So what's on the screen now, comprehensive set A, these are a set of options, and everything under this number 1 are options addressing easy, equitable access for the public that's straightforward and uncomplicated, since that was one of the needs that the work group identified. So we're going to be going through and looking at these to identify the things that you like or the things that you have questions about. the set of options, when we get the comprehensive set B, it's a different person's take on what are ways to address these same needs. All of the options address the needs that the work group identified. And at the end, what makes it such a long document is the appendix lists everybody's responses to all the questions verbatim. So the top part of the document is looking at kind of some specific options in each of the areas. And then the appendix, we wanted everybody to have a verbatim representation of what everybody sent in. So everybody could see all of what they sent in is represented.
Okay, so what is then the collation of options?
So for example, there were two kind of responses that were really substantive and had a lot of detail in them. So we broke those out as separate options. And then the third set of options is all of the work group members. We merged all of their options by response to the needs that were identified.
Okay, so does the collation of options incorporate all the ideas from the comprehensive options? That's where I'm a little confused, because
the comprehensive options that were the really detailed options that were delineated are separate because they were so dense and we couldn't pull them apart and keep their meaning, their meaningfulness. So the comprehensive options we pulled out to look at first, and then the collated options that include all of the insights from all of the work group members and the submissions of all of the homework are all put into one document.
Okay.
So there's two, is this making sense? There's two separate larger pieces, and then the third piece is collated everybody's ideas, and then the appendix is the verbatim of what everybody sent in for the homework.
Okay, so but a lot of what's in the comprehensive sections are also incorporated in the collation sections.
The part that's in the comprehensive, the part that's the collated part is all of the responses from work group members except for the two substantial options.
Oh, so the collation is not a collate. It's okay.
Right, because we weren't able to break apart the option A and option B. The responses were so interdependent, we couldn't pull apart those responses to put them in the separate sections. Okay. So, are we at the number one? Yeah, let's look at the comprehensive. Okay, so I want to make sure that landed for everybody, that it makes sense what we're looking at. So this is the first comprehensive set of options. There'll be a comprehensive set A, comprehensive set B, and then after that will be the collation of all of the options together from everybody in the work group, except for A and B, which we pulled out separately because we couldn't figure out a way to break them apart and have them still make sense. Okay. Other questions about how the document, thank you for that question. Other questions about how the document's organized? And then again, the appendix has everybody's responses verbatim. Okay. So let's start looking at the document upload is hanging and may not be complete. Thanks, James, for noting that. And also everybody's received a copy of this document a week ago. It was emailed to all the work group members. So if you can't get it from the link in the chat, you should be able to have it in your own email. Okay, so this is the need identified is the easy, equitable access for the public that's straightforward and uncomplicated. So in this first set, 1A, an option is prepare and disseminate communication on how vital records that is customer focused. The primary means of communication is via the web. The website needs to be clear and designed with the customer or public perspective. Gather input from customers and the public on the website if possible. Information needs to be available in different languages and following ADA standards. Determine if having a Facebook page, Instagram, or X account is a good option for providing information on how to order vital records. So here's the question to the work group members. Are there things about this that you like? If so, what do you like? Are there any questions in here in 1A, anything that you have questions about? So you can unmute or you can write a response in the chat. If there's something you like, you could copy and paste and drop it into the chat, whatever works for you. Not seeing any comments about 1A. We'll go on to 1B, review VitalCheck ordering web pages on a regular basis to make sure the information for ordering Oregon Vital Records is updated. Ensure the contract with VitalCheck has clear language on how orders that can't be processed quickly are addressed. The process need to minimize the amount of time problem orders stay with VitalCheck. These orders need to be forwarded to Oregon Vital Records timely. This will allow faster resolution and minimize the orders getting lost in the VitalCheck queues. Anything that you like about that or any questions you have? Thank you, Lucy, for identifying a part that you liked. Okay. 1C, request that all County Vital Records websites have specific information and consistent information on how to order vital records per policy and law, provide standard language for websites that is customer and public focused. Questions or things you like about that one? The next one is 1D, provide links on state website to County Vital Records websites. Things that you like or questions about that one? Lucy says like all of 1C, thank you. Okay, then we're going to go on to 2, consistent and clear standards, policies, and laws. Ginger likes 1D. The need, so this connects to easy public access. This is the need number 2, consistent, clear standards, policies, and laws. Need is related to the development of standard policies and laws. These are developed at the state level under the ORS and OARs with input from partners in the community. Standards and policies should reflect the law. Standards, policies, and laws should be gathered and reviewed for consistency. Standard and policies should be updated as needed. A vital records policy and law reference area on the website and intranet should be developed. So there's one reference place for these. The policies should be reviewed annually and updated when laws are implemented, when new laws are implemented. Questions, things that you like about 2A? Okay, 2B. Vital Statistic Administrative Rules, the OAR, should be revised to be written in plain English and to streamline many of the areas that have been troublesome. This is a time-consuming project. It was initiated in 2019. Significant progress was made by State Vital Records Office. The work was done in 2019 can be used. However, there will need to be some significant shifting of priority areas or additional staffing resources at the state to oversee this project. Additional staffing resources are estimated for an administrative specialist 2. Rule coordinator is $172,000 for a biennium. Questions or things you like about 2B? Okay. 3, timely registration of birth and death records. The options differ for births and deaths. So for births, under current law, they have to be filed electronically. In June 2024, 99.6% of births were electronic. The median number of days for registering births is 4. The law is 5 days. However, the primary challenge is related to births not getting registered because of the acknowledgement of paternities are not processed timely. Births that have pending AOPS are not registered until the AOP is processed. Okay. So here are some options in 3A. Examine workflow process at the state and have births automatically register even those with pending AOP. Certificates can be issued and the social security number, et cetera, received. A new certificate can be exchanged when the second parent is added after the AOP is processed. Things you like things you have questions about in this option.
So Alana, can I just chime in here?
Sure.
So if you're not, so are you asking that I mean, these are all options that we have, that the work group has provided as ideas for options. So if we're not saying we like it, does that mean we don't like it? That's because that means that right now there's only been like 2 that people like. So that I'm just a little concerned about what you're asking us to actually communicate on, because.
Right. Thanks, Jennifer. So I'm asking people to say if they like something or if they have questions about it.
Right, but if there's no one saying that they like it, does that mean then it's not a go?
Well, yeah, I think you're right. I should be asking if people dislike it too, if people have an issue with it.
Okay, because we're going through these very quickly. There's 46 pages here. There's a lot of detail, and but I'm just concerned that it's okay. So if no one's making a comment on it, then is it just we're just saying fine, we're not gonna consider it, and also thinking about the fact that this is a legislative report related to a House bill that specifically had very specific language on what we should be doing in it for options. So I just want to make sure that we're acknowledging that. So I'm just a little concerned about the process.
Yeah, thank you. So we, I think all of the things, okay, so 2 things. First of all, work group members are going to be asked to review this and identify things that they like or don't like when we're not in the work group. But this is a time to go through it and review it as a group and see if there are things that people like or have questions about. If people are having an issue with it, they can tell us in the homework when we work with that between now and the next meeting. And the whole document, we're not going to look at the whole document because the part that's a compendium, that's a list of what everybody submitted, is a repeat. So we won't be looking at all 47 pages today because the appendix is a cut and paste of what everybody submitted. So we aren't trying to get through 47 pages. Ginger, I see your hand.
I do have a question, and I want to go back to 1A and 1B because a lot of the language in each of these is very similar. So it's almost as if they could be combined and one option be made of the 2, right? So is this like the type of homework that you're suggesting that we will be getting there? Because again, some of these are very similar in language and idea. Yeah. Maybe one option has something additional, but it's about the streamlining of the options so that they are like one and the same. Is that what we're looking for?
Yeah, what we're looking for is to kind of identify the things that the work group members, the options that the work group members like and would want to support. And also the inverse, if there are things that you really don't like or would not want to support as an option moving forward. And you're right, and you're absolutely right that there is duplication between these ideas. And there's overlap. That's true. Part of that's because of the complexity of the system. Part of it is because people were trying to answer each of these needs. And there's a lot of overlap between the needs. So yeah, you're right. There is, you are going to see suggestions come up more than once.
So what is the methodology then to disseminate the essence of it without all the repetition? Is this something that we take as homework and look at that? I'm just kind of curious, what process do you want my brain to engage in here? So
yeah, the priority for today is to go over these options and make sure that people don't have questions.
Okay.
That there aren't things that are included here that they're confused about or that don't make sense, or that they want to say right now that they really don't want to keep that as an option going forward, or they really like this thing and they do want to. But this is the acquainting us all with what are the options that the group has come up with. And then we'll be winnowing it down between now and the next meeting so that we're only looking at things that people think are still viable options that they want us to move forward. Does that answer your question?
Yeah.
Ginger? Okay.
Thank you. Mhm.
Thank you. No, thanks for asking. Trying to be clear. Okay, back down to 3. I think we're up to 3. Okay. So this was about the births. 3B, in cases where hospitals don't get birth records, start in overs, require hospitals to have separate reporting of births that's shared with the state weekly or as requested, and that is compared with overs to make sure births are started. This is already in law. And Jennifer says, like 3A, 3C, communicate directly with hospital administration when facilities don't have timely registration, and that's being done now. The deaths is a separate topic. So in June 24, 88% of death records were fully electronic. So here's a note, these first 3 options do not need legislation to implement. The 4th does need legislation to be implemented. So 3E, communicate on an annual basis with hospital administrators so that all deaths that occur in a hospital must be entered into overs as stated in law. Determine which medical certifiers are continuing to complete paper records and partner with local funeral homes to encourage medical certifiers to get on overs. Have the CHS Partner Services team offer to provide in-person or virtual training on how to use overs. Also provide information on training provided by CDC on how to complete cause of death portion of a death record. This is currently being done. Develop trainings for funeral homes and set up a funeral home work group. CHS plans to do this in 2025. And 3H, establish a law requiring all death records for deaths that occur in overs to be in Oregon to be completed in overs. There should be some option to allow state registrar to determine exceptions, for example, home burial. Okay, so that's the one that was identified as needing a law change. Questions or comments? Ginger says yes, 3E, F, H. Okay. Number 4, taking a look at number 4. Derek, I see your hand.
I guess the question is, if it's for a proposal to the legislature, should any of our proposals that our options that we give to them not require legislation?
Well, I mean, the work group can make recommendations of the things it would like to see. For example, if the work group was to make recommendations around funding, for instance, that wouldn't necessarily require legislation, but it would require funding allocation. So the work group can make recommendations as long as it's in service to fair and equitable access, right? That's the charge to the work group. Does that make sense?
Yeah, that makes sense. So it's maybe something that it doesn't require legislation to do directly, but indirectly, because it would increase the need for funding, would require legislation. That makes sense. Thanks.
Right, or an allocation. Yeah. Okay, so continuing to familiarize ourselves with options. So this is something we've had a lot, this next number 4, we've had a lot of conversation about this topic. For counties to be able to issue certificates regardless of place or dated event. Derek says, I like 3H. Providing counties the ability to issue certificates regardless of the place or time of the event would require a change in law and regulation. Over systems modification, changes in all workflow processes at the state and county, changes in procedure, and changes in funding at state and county. Implementation of a significant change would not be feasible until 27 or 28, depending on how implementation is funded. Regardless of what option is chosen, the following would need to be done. So this is in order for counties to be able to issue certificates regardless of place or date of event. A project would need to be initiated that would take 2 to 3 years to implement, require project manager, staffing resources, estimated costs for PM is 239,000, program analyst 198 per biennium. County staff would need to be dedicated to the project as well and would depend on the level of staff assigned to the project and how much time. It is likely each county office would need to dedicate 0.25 or 0.5 FTE to work on this project. And if the salary is equivalent to similar positions at the state, the county cost would be 43 to 86,000 a biennium. RS 432 and OIR 333-011 would need to be amended. So this would be an amendment to allow County Vital Records Office to issue birth and death certificates for events that occurred outside of their county for any date of event. This would require legislation. An analysis of what OVR system functions would need to be An analysis of what OVR's functions would need to change would need to be completed. The cost to make systems changes would need to be determined. Based on current knowledge of OVR's, it's likely the 6-month issuance date and county event requirements are coded into the system. Changing the code can occur only twice a year, requires a contract amendment and full regression testing of the system. A rough estimate to make the coding change in OVR's is $200,000, and the estimated staffing cost completing the requirements, specifications, and overseeing testing is $100,000. Testing would need to occur in each county to ensure correct implementation. This is likely one-time cost. The estimated cost to the county would be covered in the FTE cost noted for the overall project. I saw a comment from Lucy. Would need to be amended. The ORS and OARs would need to be amended to allow County Vital Records Office to issue birth and death certificates for events that occurred outside of their county for any date of event that would require legislation. Thank you. A detailed analysis of work project changes and costs of these changes needs to be completed to ensure counties understand what's expected to meet this need successfully. Currently, all births the counties issue are issued from OVRs, and 88% of the deaths are now available to issue from OVRs. If issuance of births and deaths regardless of date of event is implemented at the county level, counties will need to ensure that all laws, rules, and procedures are followed for eligibility and identification. Currently, 90 to 100% of birth records issued at the county are issued to parents since the child's under 6 months old. If counties can issue birth records for events that occurred from 1903 to present, the orders will be from anyone eligible to order the record under ORS 432-380. Eligibility and identity of the person ordering the records must be verified to ensure that the person getting the birth record is allowed to get it under law and they are who they say they are. In addition, the customer often needs to be contacted to provide additional documentation or information. This additional screening and follow-up takes time. This is also the case for death certificates. Most death records issued by the county are to funeral homes and likely to funeral directors that are regular customers. So establishing eligibility and identification is relatively easy. If death records are issued by the county for any date of event, 1903 to present, orders will be received by anyone eligibility under ORS 432-380. Establishing eligibility often requires additional documentation must be reviewed. The additional screening and follow-up takes time. The increase in time it takes to do additional screening and follow-up is estimated to be 15 minutes per order when eligibility and identity can be easier determined with the documents provided. For orders where there must be a review of complex documents, referencing guidelines, and communication with customers, the order may take up to 60 minutes per order. This additional time needs to be considered by each county along with the extra staffing cost to do the work. So this is all kind of thinking about if this change, what are the ramifications? Staffing needs and workflow process improvements at the state to be able to support successful implementation of this need must be examined. Since counties will not have electronic access to all vital records until all records are in the system, they will need to contact the state to provide records that are on paper and microfilm. This will require changes in work process and likely require additional staffing. The state may also need to dedicate staff to provide help desk support solely for the counties to provide assistance on eligibility and screening. It is likely 1 FTE at the state would be needed to provide support to the counties at an estimated cost of $137,000 a biennium. A thorough analysis of the funding. Oh, Lucy, I see your hand. Sorry, go ahead. Lucy? Can you hear me, Lucy? Well, chime in when you come back or when you can come off mute. Okay, so we're still looking at what it would take for this option. A thorough analysis of the funding implications of providing access to births and deaths for issuance regardless of location or time of event must be done. Currently, counties are limited to only issuing birth and death records for events in their county and within 6 months of the event. This has been law since 1997. Currently, the county and the state get the entire fee for any birth or death certificates that they issue. The fee distribution makes sense when county vital records offices were doing many of the tasks that are now being done automatically or by the state. County vital records offices no longer register paper birth records, complete amendments to birth records, or notify AOPS. All birth records issued at the county are issued electronically. Registration of hybrid death records now only accounts for 10% of death records, though it does vary geographically. Amendments done on death records at the county level can only be done on the paper hybrid records registered by the county. Many counties opt not to do these amendments and will rely on the state to complete them. Therefore, the different vital records tasks that must be done at the county level has declined dramatically in the last 18 years. The tasks done in the past at the county are now completed electronically in OVERS or are done at the state. All training and technical support is provided by the state. Questions, comments? That was a lot. There's another paragraph to look at. Okay. Yes, Hayel.
Yes, I was just gonna go back to the part about the drop to paper, the corrections here at Malheur County. We still do them, and then as far as like going to issuing for any county for any amount of time, in talking with my supervisor, we agreed that we would only like to, here at Malheur County, we like to issue birth certificates for the families due to like school issues. So we were thinking of capping it like at 5 years, because I mean, when the kids are older, they have more time. Like if they're gonna go to college and they need a birth certificate, they have more time. But like here, parents might need more their birth certificates like for school starting like at 5 years old or something. And we didn't even really want to touch you know, records that are older than that, because the more complex the like if it's a, I don't know, a friend of the family and they have property together with a decedent, we really don't want to touch it. We really feel good about referring them to the state, because the more complex, the more likely I'm gonna say, oh, that's a question for the state. So we just like, we wanted to keep it at a cap, not like all the time, like forever and ever that we can issue. We feel comfortable with the state handling older records, not us getting involved in really complex issues where we like the state to make the call.
So up to 5 years for birth records, so that kids are getting enrolled in school can be helped with their birth records, but not for death records. You'd like to refer those to the state.
Correct. The older they are, or the more complex, we prefer the state to take over, because they have the expertise. We don't really feel comfortable just issuing, or if it's something really complex, that we don't really want to mess with that at all. I feel good saying that that's a question for the state. They can help you determine that, because I really don't want to, I don't feel prepared to be making those kind of decisions.
Great. Thank you. Lucy, I see your hand.
Thank you. Sorry for earlier. I lost my mouse abilities, so I couldn't unmute. I would like to go back and we got so far ahead. I don't know exactly where it is in the document, but there was something stated about making sure that if the counties issue or after 6 months, if that's implemented, that, you know, you'd have to have extra training and all this stuff for eligibility and what's the other word? currently, if the counties are issuing within that 6-month period, they obviously have that training about, making sure that the requester is eligible to receive the vital record. So I'm kind of confused as to why it would need to be anything change on that in that regard.
Yeah, thanks for that question, Lucy. So the question is, if they're doing it up to 6 months anyway, what would be the additional training or support that county staff would need to be issuing records after the 6-month point?
Correct.
Any thoughts about that?
Elena, would you like me to chime in?
Sure.
Okay, that's exactly what Hayel was talking about, is that anytime you're going over 6 months and because the counties currently are mostly issuing birth certificates to parents, that's easy eligibility. Most of the death certificates are issued to funeral homes, that's easy eligibility. When you moving to older records, anybody ordering a birth certificate, anybody that's entitled under the ORS, it can be any family member. And so it gets way more complex as far as having to determine eligibility, what documents are required. So, there's a large percentage of follow-up that happens. And then even with death certificates, you're not issuing to funeral homes who are automatically are eligible, but you're issuing to any family member, an estate, a title company. So there's a tremendous amount of extra work, and that's where that extra work comes in, but also extra understanding of all of the eligibility rules and guidelines. So the older the record, the more complex it gets for making sure that eligibility is met and that identity is met. So I hope that answers. So there would have to be extra training provided. We would have to make sure that they understand that that level. And again, that goes back to exactly what Shahal said about not wanting to take on those more complex orders and deferring those to the state.
All right. Thank you, Jennifer.
Thanks for clarifying that.
Yeah, thanks for asking the question, Lucy. Next paragraph, there needs to be some sharing of fees between the county and the state, or direct support from the counties if this need is going to be met. The amount that the counties would need to cover would depend on which option is chosen to meet this need. See number 8, we'll get there for more analysis. It should be noted that the counties will need to support the system even if no changes are made. Okay, now we move into the options that would require legislation. These changes would require legislation. Counties issue birth and death certificates for 1 year instead of 6 months. Regardless of where the event occurs, the option would reduce the amount of revenue at the state, assuming 30 to 40% of the records issued at the state within a year of the event is shifted to the counties. The estimated loss at the state would be $384,000 to $512,000 in one biennium. The option would still set up competition amongst the counties. It also does not meet the spirit of equitable access to all vital records throughout the state. Customers would still need to go to the state to get death and birth certificate records if the date of the event was over 1 year. For B, the work group has identified that current methods for ordering certificates varies among the counties, is duplicative, confusing the public, and not equitable. Rather than focusing on the type of event, birth or death, the place of the event, and location of the event, it may be best to examine the method of ordering when trying to meet this need and many of the other needs proposed by the work group. This option proposes the following. So here's a proposal. Counties only provide in-person ordering for births and deaths, regardless of date or location of event. The State Vital Records Office closes in-person issuance. This means that anyone can go in person to any county to get their vital record. This option still sets competition among the counties. The counties would get the fees for the records or a portion. The state would not offer in-person orders. 4D, mail-in orders, internet and phone orders are only offered and completed at the state. Counties do not take mail, internet, or phone offers for vital records. This removes duplicative ordering methods throughout the state and provides one-stop shop for mail, internet, and phone orders. Questions or comments about 4C or D? Okay, the option would require additional resources to provide paper microfilm records, real-time assistance. Having the state take over all mail, phone, and internet orders would eliminate the different ordering options at the counties, which are inconsistent across counties and tend to be confusing for customers. Counties that have established contracts with internet vendors would have to end their contracts, but would no longer have the cost to maintain the contract. Derek says, I like 4AD if limits are placed. Would need workflow processes at the county would need to be examined to see what changes would need to be made with customers, especially funeral homes, order via mail or fax. There would still be a loss of revenue at the state since in-person customers would get birth or death records for any event, any date of the event. However, if fee sharing or direct payment was established with the county, the loss may not be as great. The estimated loss in revenue for the state is 1.1 million. Staff who are currently working the counters would shift to providing the described support. However, this loss is still significant, impacting basic operations of vital record system needed by the state and counties to do their work. Questions about this section? Okay, the next one was for all death certificates to be fully electronic. That was addressed already in this option. 7, records to be fully electronic. This one has multiple options that were already addressed. Note these options don't require legislation. Old records fully electronic. The goal is to have all 6.5 million vital records available to be issued from OVRs. The following records currently are not in OVRs. Those are listed. Ginger, I missed your comment. 4D would change the way hospitals direct patients to order birth certificates when the county would be closest. Okay, thank you. Okay, so just a couple more in this option packet. Under 7A, the records are on paper or microfilm. There need to be amended records that have been relocated that are not in OVRs. Converting the records to electronic form and adding them to OVRs is a large project, as considered to be an IT project. It requires special oversight and governance. The project could take 1 to 2 years to complete. Currently, Oregon has an enterprise contract with a records management company that does the work. An RFP would not be needed. The cost is unknown, whereas an estimate of $200,000 per biennium has been budgeted by the state for the project. The project hasn't been started due to staffing capacity. The state would need additional staffing to manage and staff the project. Cost estimates, $239,000 for a project manager, $138,000 for an office specialist. One-time costs. Okay, let's see if we can get through 7. The electronic systems need to be interoperable, meaning accessible in all interconnected systems. If you can scroll a little bit, Cindy, the goal of the Center for Health Statistics is to implement data interoperability with different systems to collect birth and death data using HL7FHIR. Oops, that's a little too much scrolling. Can you go up a little bit? The project would need to work with external partners to establish interoperability. There's information about the 2021 CHS ELC CARES Act data modernization funding in the amount of $1.35 million to implement interoperability. Another grant of $1.38 million was awarded in 23. The funds end in July 27. No additional federal money is expected. This funding only covers establishing interoperability between the state vital record system and the National Center for Health Statistics. Interoperability using those standards needs to be developed between data sources and the state vital record system. Other data sources include EHRs for birth and death, state medical examiners. Establishing interoperability in each system is considered a separate IT project. Cost estimates range from $500,000 to $1 million. I want to get through 8, see if there's any questions about the interoperability. 8 is sustainable and equitable funding to support the system. CHS receives revenue from 3 primary sources: vital records fees, government agencies, and federal contracts. The annual revenue from these primary sources was $14.80 million during the 21-23 biennium. Vital records fees provided 60%, federal funds 10%. The remaining 30% came from Oregon government agencies such as DHS, Division of Child Support, ODHS. CHS received ELC CARES Act modernization funding, $1.3 million, a grant of $1.3 in August to do the interoperability. The funds end in July 27. No additional federal funding is expected. A savings of $3.8 million from the 1921 biennium increased the revenue to 19.96. Okay. The estimated cost to operate and maintain the vital records system and complete federal grant and contract requirements in 24-25 is $20.7 million. The increased amount for staffing, COLAs, but all expenses remain constant. Revenue estimates are anticipated to be the same since they have been relatively consistent. Revenues estimated at $24.28 million. Which provides $3.5 million surplus at the end of the biennium. As good stewards of state resources, we're expected to have at least equivalent of 3 months expenditures and savings. The estimated savings for 23-25 is 4 months. Projected revenues versus costs for future biennia reveal that expenditures will exceed revenue by 1.46. Additional revenues will be needed just to maintain vital records and statistic systems that's needed by the county and the state. So here are some ideas about funding options. Fees increase. And this is something that we've talked about in this work group before. This option requires following the legislative process and rule change for fees. A vital records fee increase will be needed just to maintain the current work, much less modernize. A fees increase was approved by the 2015 legislature, went into effect 2016. The previous fee increase was in 2003. Unfortunately, basic projections with different fee options that don't consider additional staffing, reclassifying positions, and additional money for overs modernization show that even a $10 fee increase, which would be 40%, will not provide enough revenue to remove the deficit by the end of the 27-29 biennium. CHS should not propose a fee increase or other options funding increases until this work group publishes options required in the bill to determine equitable access to vital records and fees throughout the state. The work group has been meeting, okay, this is about us, this will work, options will be recommended to the legislature by January 1. Based on the time of the work group report, preparation needed for implementing fee increase, the earliest fee increase could be expected is 2028. Okay, questions about that? That was a lot of money talk. Okay, 2 more sections. Increased government agencies payment. The amount of government agencies pay for services will need to be increased. However, CHS should not continue to rely solely on government agencies to fill the funding gap. 8C, County Vital Records support. Financial support from County Vital Records offices to maintain and operate the state vital records and statistics is needed. County Vital Records office use the state system to issue vital records locally, get the entire fee for the certificates they issue. These offices also rely on the state to provide technical support and training. Currently, counties provide no support for the vital records and statistics system that they need to issue certificates and generate revenue from the sale of these certificates. County support is needed even if there is no change in the law related to the 6-month date of event or place of event. Support from the county can be in the form of fee sharing or set amount annually or biennially. A funding formula would need to be determined in cooperation with PhD and CLHO. Consider general funds. I want to get through D and E and then some wrap-up, a couple of wrap-up things. Consider general funds to cover the revenue for ODHS, Office of Children Advocates, generates from the registration and issuance of birth records under ORS 417-825. ODHS receives $1 for each birth register and $1 for each birth certificate issued. 8A through 8E should be pursued. Derek said this is a cost to the state and the counties. This is equivalent to approximately 80,000 per biennium for the registration of the records, 240,000 a biennium for certificates issued at the state, for a total of 320,000 a biennium. County Vital Records Office also pay $1 per certificate issued. This option would require legislation. 8E, general funds. The option requires official request from agency for general funds or legislation. Additional funding options need to be explored to accomplish interoperability, getting older records fully electronic. These are large IT projects requiring funding over a few biennia to complete. Not likely be needed at the same level once implementation is completed. Such projects may be conducive to allocation of general fund money during the project period. General funds could also be dedicated to funding one-time project for getting all older records fully electronic. So I'm going to stop there. We've covered a lot. We've covered most of this option. The request is for you to look at this and the other options and come back, and we'll send you kind of a homework format like we did the last time to try and fill out and chunk in the things that you want to consider as options to recommend to the legislature. We're not making any decisions, but we are trying to narrow down what is it that you like, what is it that you don't like, what do you want to recommend going forward. As always, if you have questions, there's this huge resource library that contains all of the work, conversations, presentations that have been done in this work group, as well as other documents that were discussed here. So if you all have questions as you are going through and identifying what options you want to recommend, or you're at least leaning toward, please feel free to reach out with any questions. Any other questions before we wrap for today?
Yeah, sorry, Alana. I think that so we need some clear guidance on so the numbering system, like the C1, the numbering system you used, are considered those options, right?
Yeah.
Okay. So like B1 is set, that's one entire option. C1 is one entire option, just like what we did where we had, and because you've gotten multiple numbering systems here, so they're not unique numbers.
Yeah. We'll sort that for sure before we send it out as homework. We'll do that in the next couple of days, so everybody has most of the month to look at it and come up with. Yeah, we didn't try and merge all of them on purpose because we didn't want to lose the integrity of the individual suggestions.
Okay. And then also just to confirm, in the FAQs, is there a link to the final enrolled bill? Because I really think it's important we reread the bill. Because I mean, we've been focusing on equitable access and equitable fees, but the way the bill is written, it's equitable fees to maintain the system.
Yep. Thank you, Jennifer. Yeah, I'm sure that it's in there,
Okay.
and we can also highlight it to make it easy to find. Yeah. Okay. Well, thank you all, everyone, for hanging in for this review of some of the comprehensive options. We'll send you a format to start giving your feedback about which options you like or you're interested in, or options that you also have concerns about. Thanks again, everyone. Appreciate your time. Appreciate in advance the time you're going to spend looking at this document and sorting through and identifying the options that you'd like to move forward with. Thank you, everybody. Have a good afternoon.
Thank you.